Welcome back to TV5 News at 9, everyone. We're heading into cold and flu season. Joining us this morning to get us ready, we have Angela Williams and Heather Halm from Great Lakes Bay Health Centers. We appreciate you both being here this morning.
Thank you for having us.
Absolutely. Okay, so what important information do you have to share about flu season?
Well, once again, it's that time of year.
Yeah.
The fall. You see how the weather is changing. Cold in the mornings, hot at night. Allergy season along with colds, flu, and other viruses. The COVID.
Yeah.
We always mention COVID.
Yes, we have to.
And COVID is prevalent again. And so it's important to take those precautions and recognize the difference between all of these viruses. So, and Heather is our expert on immunizations and vaccines at our location, and she's going to share lots of information with you today.
Very good. Do we know, what should we know about flu season, maybe RSV season as well?
RSV is kind of new for us here, so it's really important for adults 60 years and older to get vaccinated against RSV, especially those 75 years and older population, as well as pregnant women and babies also protected against RSV.
What is RSV?
It is kind of like cough, cold, seasonal.
Okay.
Adults is going to be early fall is when they should get vaccinated. Pregnant women should get vaccinated during 32 and 36 weeks of pregnancy, and then babies, if they're born during RSV season, they get bad cough, whooping cough, respiratory issues that can lead into worse.
Right.
And Heather, you mentioned earlier that if you've had the RSV vaccine, 2 years ago, you should get it again every 2 years. Is that correct?
Yep, so if you had it last season, it was new, then you would skip this season and get it next season, next year.
All right, but those flu vaccines are yearly, right?
Flu vaccines are yearly, as well as COVID vaccines, too.
Okay.
And one of the recommendations is try to get your flu shot before the end of October, even though people wait, but you want to protect yourself. Timing is important. As she mentioned, who should get vaccinated, but at the same time, you want to protect your family, you want to protect your co-workers, and you want to protect your kids at school, because we know germs are prevalent. We always talk about the first defense is hand washing, but it's more to it. We don't want people to be sick. We want you to try to do what is necessary to protect your health.
Yeah, and I like the get it before the end of fall, because I know my grandma would always say, get your flu shot early so that it takes its time to run through your body so that you are protected when it comes time. So any other tips? You said hand washing. What other type of tips can we practice during cold and flu season to make sure that we aren't spreading germs?
Washing hands, of course, super important. If you're sick, you can mask up. I mean, coughing, sneezing, we want to make sure we're protecting everybody from that. So if you're able to mask up, if you're sick, mask up. But hand washing, super important.
Okay.
In addition to that, sleeping. Get enough sleep, eat healthy, exercise. Right now is the perfect time to get fresh air. It's a beautiful time in Michigan, and you want to still be proactive in your family in terms of health. And if you haven't had a physical in the past year, don't just put everything off. It's important, because you could be missing something serious that could be taken care of.
Yeah.
So our goal is always about preventative medicine, preventative health care issues, and taking the appropriate measures for that.
Speaking of preventative measures, how can we practice those, whether it's at home, work, or school? Kind of along the same lines?
Along the same lines, so we do encourage everyone to, if you have the sniffles, and you feel like, okay, maybe I should test for COVID, if you have a positive test, the practice is still to isolate, wear the mask, make sure that everywhere that you touch is sanitized, and protect your family by getting tested. Let the whole family be tested if possible. And bottom line is, we don't want you to get COVID. We want you to take the COVID vaccine, which is now Pfizer, right?
Yeah.
And it is available for everyone. The drugstores have it, as well as Great Lakes Bay Health Centers. So encourage your friends to get vaccinated, not only for COVID, but flu. The commercials now are showing flu and COVID. Get it taken care of. And if you test positive for COVID, the commercials all in the news now are talking about Paxlovid. And
Yeah.
Paxlovid is available. Contact your doctor so that you can get a prescription, but be prepared is our message to everyone today in terms of preventive measures.
Very good. And I like the Sneasels term. It was very good. Don't worry about that. So let's talk about who's at higher risk for flu, RSV, and all these viruses.
So high risk, as we mentioned before, age 65 or older, babies are at high risk, and anyone whose system is immunocompromised,
Okay.
whether with cancer, any type of other, diabetes, hypertension, any chronic illness puts you at a higher risk.
Okay.
And you want to dispel or do whatever is necessary to make things stable for your health status.
Yeah.
But
It's not
if
fun being sick.
No, it's not fun being sick. And if you have any respiratory challenges or you're feeling sick, go to the emergency room or call your doctor right away. We don't want you to just put it off.
Yeah.
There are too many illnesses in our lives and in the surroundings of everybody now that we need to take those precautions and get taken care of.
Yeah. Can you speak to the importance, either of you, about why we got to get these vaccines?
I think it's important, especially for the older population, age 65 and older. They're at a higher risk for getting pneumonia after the flu, if they've had the flu. So getting the flu shot, there is a high dose flu vaccine available for those older adults, which has a little bit more of the flu vaccine in it than the regular dose. And that helps prevent more for those patients that are susceptible for the 65 and older population.
And we do have that vaccine
We
available
do have it
now,
available
right?
for all of our 65 and older population.
Yep.
Perfect. I was going to ask you, like, how does someone, get with you guys to make sure that all of this is in order?
Anybody can walk into any of our sites to get any of these vaccines.
Okay.
They come in for a nurse visit, and we can give them whatever they need.
All right. Is there anything else that you want us to know about flu and vaccine season?
Well, first of all, as Heather mentioned, Great Lakes does have access to those vaccines as well as the local pharmacies around here. Don't forget that we have 3 pharmacists or pharmacies at Great Lakes that our Great Lakes patients are not aware of. And we provide the same services as the local pharmacies around here. In addition to that, we remind our audience that we accept new patients all the time,
Okay.
regardless of your ability to pay your insurance. We take private insurance. If you are uninsured, we help you register for an insurance plan, including Medicaid.
Okay.
But please don't feel that you cannot take care of your health because of the fact that you don't have insurance.
Very good.
Yep.
All right. I appreciate you both coming in. This is such an important topic, and thanks for being on top of it, I should say.
Thank you.
You're very welcome. And if you want more information about this, you can always find it in the Hot Links section of our website at WNEM.com.